Kia ora, morning, thank you. Thank you for welcome and having some time with us. I'm conscious that we have got 10 minutes to try and give you a bit of an insight into the evaluation, so we will be quick, but you've seen Nishadi before, and you've probably seen David Todd, our other colleague as well, and we've been out connecting with you for the evaluation. And so this is a sort of overview of the framework and approach. So as you've all been delighted to be filling out all our lovely surveys, which you've been kindly doing, and they are a bit lengthy, so we do really appreciate you taking the time to fill those in. But we've also been really fortunate to come and see some of you and be able to do some site visits and really try and capture the level of work that you've all been doing and the support that you've been giving to the collaborative and sharing back some of the learnings. And so we're going to share a few of these today, but it is really just a quick snapshot. And then we will be providing you with fuller feedback once we've collated the surveys, which you'll be very delighted to know there's another survey for you to fill in today. So that's exciting. So please do take the time to fill that in. So here's a quick snapshot into some of the changes that we've been seeing. So we've seen an increase in participants' experience with formal collaborative methodologies. So we see people moving from none or little at baseline into shifting up into more little or moderate knowledge. So you can see the sort of changes and increases in knowledge that the collaborative has been supporting. Similarly, we see those changes in terms of quality improvement approaches and processes and methods. People had sort of varying degrees of experience and levels of understanding, and it appears that the collaborative has supported increases in that knowledge and understanding and engagement. And similar trends are also seen in terms of knowledge of quality improvements, experience in applying them, and the plan, do, study, act tool as well. There's also lots of qualitative feedback that we've been pulling together that has highlighted some of the journey that you've been taking, and I'll hand over to Nishadi to give you a bit of an insight into that.
Thanks, Sarah. So reflecting on the surveys that you filled in through Learning Session 1 and Learning Session 2, as well as the site visits, it's evident that the DHB teams have been through quite a journey, and this is reflected in this diagram here. So through this journey, there's been a range of factors and enablers that have supported the teams through their journey, including the characteristics of the DHB project teams themselves. There's a lot of passionate, committed, enthusiastic people out there that are participating and making it happen and making it work in terms of what's happening day to day, and as well as contributing at a regional and national level. The involvement and support of key people, including clinical personnel, health quality and safety team, and the medication safety committee. This has also contributed to enabling the DHB project teams. Leadership and support from DHB management's also been key for some teams in terms of getting their buy-in to support from those other stakeholders to ensure that the teams on the ground can do the work that they're doing. And then some targeted support from the national HQSC team to work through some of the improvement methodologies and to support them in their harm areas that they're focusing on. There's also been some barriers that the DHB teams have faced, time and resource being some of the most prominent barriers that have come up. This, of course, is not unexpected. We understand that DHBs have a lot going on and a lot in their work program. There's also been some barriers in terms of competing priorities and demands, and clarity around data collection requirements. So even though there's been some challenges that the DHB teams have faced, the teams have still gone through quite a significant process, and through that process achieved a number of different activities, learnt new skills, gained new experiences. You know, they've formed teams, they've identified harms, project plans and charters have been developed. People have learnt how to do driver diagrams, collected baseline data collection, as well as collecting data on an ongoing basis. And through this, done a range of PDSA cycles, and through that, moved towards identifying interventions to include in the bundle. So as an overview, we can see that there's been a high level of engagement from DHB teams in terms of contributing to this collaborative. There's been a significant amount of work done, throughout this journey and throughout this process by the different DHB teams. There has been an increase in quality improvement capabilities. People's knowledge has increased, their experiences in this area has increased, and there has been quite a lot of sharing between DHBs at forums such as this and the previous ones. So in terms of next steps for the evaluation, as Sarah mentioned, we do have the Learning Session 3 survey. This is going to be handed out later this afternoon, and as Sarah mentioned, we'd really appreciate your support to ensure that everyone fills the survey out and provides feedback. This is really important for us in terms of understanding your views and experience from the last phase of the collaborative, and to get that feedback across all of the DHB teams. In terms of the next phase from here, we will be conducting site visits in early 2016. These site visits, we're going to be focusing on looking at some of the data that the DHBs have been collecting in the different harm areas, and how that data will contribute to the bundle, and exploring how that bundle would be implemented when it comes to putting that together and having that set of evidence-based interventions. And we'll also be exploring the sustainability of the emerging clinical network that's forming from this collaborative. So in the coming months, we'll be in touch with a sample of DHBs to set up these site visits. We look forward to connecting with you at your DHBs, and look forward to hearing and seeing the work that you've been doing at the front line. Thank you.